This conference will now be recorded.
Hello everyone, good evening. Today, inshallah, we'll discuss the female genital tracts. This is the second session in anatomy modules. In the first session, we discussed the female pelvis and the anterior abdominal wall. So today, inshallah, we'll discuss the female genital tracts, which includes the vulva, which involves the external genital tracts, and perineum, and the pelvic organ. Let us start our session. First, we'll start with the female external genitalia. So this is about how to define the margin of the perineum. So you can imagine this is the pelvis border, and this is the posterior superior iliac spine, and says pelvic bone, and this is the anterior superior iliac spine. This is about the border of the perineum. So what is the margin of the perineum? The pubic symphysis, scaled and tip of the sacrum are palpable on the patient and can be used to define the borders of the perineum. So this is the best done when the patient is lying on their back with their side flexed and abducted in lithotomy position. So this is how to identify the margin of the perineum. So this is about the surface anatomy of the perineum. Here, this is about mons, pubis, and this is the urogenital triangle, and this is the scale tuberosity, this palpable point, and these anal angles. So here I have two triangles, the urogenital, the anterior triangles, the urogenital, or the posterior triangle is the anal triangle. We'll discuss inshallah separately. And this is about the surface anatomy of the perineum. This is picture show the surface anatomy of perineum. First, we'll start with the vulva. What is the vulva and what is the definition of the vulva? Okay, vulva, it is involve the post-external, female external genitalia and perineum. So this is vulva. So vulva, it includes or involves the female external genitalia and the perineum. And so first we'll discuss about the female external genitalia. So the vulva are equivalent of the male scrotum. So it is equivalent of the male scrotum, and L-divine area containing various external genital organs along with the perineum. So if the external genitalia and the perineum, it is, so this is called the vulva. It's known as the vulva. So what is the external genitalia? Genital organs? It includes mons, pubis, and there is labia majora, labia minora, and vestibules, and the hymen, and this Bartholin gland, and Skene gland, and vestibule gland, and clitoris. And this is about the external genital organ. So this is the clitoris, and this is the here. This is the outer here. This is the labia majora. This is the area of labia majora, and here is the labia minora. This is the area of labia minora, and this is the clitoris, and this is the vestibule. The vestibule is the area between two minora, and this is about the perineal body. So this is generally about the vulva. Also here, this picture show the content of the vulva. Here is the mons pubis. This content here, and this is the clitoris. Okay, and this is the labia minora, and this is the labia majora, and this is the vestibules, and this is the hymen, and this is the perineum. So all this area, the external genitalia plus perineum, this is called the vulva. So we'll start with the female genital sternum. Okay. So what about the mons pubis? So we'll discuss the external genitalia. First, we'll start with the mons pubis. It is the rounded eminence that lie anterior to the pubic surfaces and contain a pocrine gland. So this is the definition of the mons pubis. It contains sweet gland and the oil secreting sebaceous gland that release substances which are involved in sexual attraction. So this is about the mons pubis. So it contains a sweet gland and the sebaceous gland that secretes substance which involved in sexual attraction. It is pheromones. This is about the function of the mons pubis. So what about the labia majora? Labia majora is relatively large and fleshy fold of tissues which pass anteriorly from the mons pubis to the posteriorly to the skin over the perineal body. So this is the area between the superiorly or the anteriorly is the mons pubis and to the perineal body. This is the labia majora, and it is comparable to the scrotum in males. What is about the surface of the labia majora and the inner surface? So the inner surface of the labia majora is softer and smoother and not covered with hair, in contrast to the outer surface. So this is the difference between the inner surface of the labia majora and the outer surface of the labia majora. Here, these contain hair or not. So it is not covered with hair in inner surface of the labia majora, and the outer is covered with hair. So this is different between the inner surface and the outer surface. The labia majora contain sweet and sebaceous gland which produce lubricating secretion, and they also contain a pocrine gland, secretion of which are responsible for the characteristic aroma of the vaginal secretion. So this can lead to change in the vaginal secretion. So this is the function of the labia majora. After puberty, hair appears on the mons pubis and the outer surface of the labia majora. The common skin, what is the significance of the labia majora? Clinically, here there is a common skin lesion which occur in this include folliculitis, boils, and sebaceous cyst. So this can occur in the skin over the labia majora. What about the labia minora? It is found just medial to the labia minora, and they contain no hair follicles, sweet or sebaceous gland. In labia majora, there is no follicles or sweet or sebaceous gland. And anteriorly, they include the clitoris, and posteriorly, they join to form furrows. So there's a rich blood supply for this labia minora. So this is make it is a pink color. So the pink color of the labia majora is due to the rich supply of blood vessels for the labia minora. On the during sexual stimulation, these blood vessels become coated with the blood, causing the labia minora to swell and become more sensitive to stimulation. So if there's any sexual stimulation. So blood vessels coagulate with the blood, causing the labia majora to swell and become more sensitive to stimulation. So what is the clinical importance of the labia minora? There is chronic dermatological disease such as like sclerosis. So this may lead to significant atrophy of the labia minora. This is the vulval condition. It is clinically named as the leaking sclerosis, which is whitish, but involves the labia minora. So this is the important disease can affect the labia minora. What about the clitoris? And the clitoris are the erectile organs located between the labia minora and their uppers, and that correspond to the penis in the male. So it is corresponded to penis in the male. It is consists of glands covered with the perineums and pubis and apody. So this is the consist of the clitoris. It is attached to the upper surface of the pubic symphysis with the help of suspensory ligament. So this is the attachment of the pubis, attachment of the clitoris to the pubic symphysis with the suspensory ligament. So what is the normal length of the clitoris? So the normal length of the clitoris is about 1 to 1.5 centimeters, and the width is about 5 millimeters. So this is about the length and about the width. So if there's any abnormalities here, or the length is more than 3.5 centimeter and the width greater than 1 centimeter, this is termed as clitoromegaly. So this is the clinically important in there is clitoromegaly, and can occur if there's more than length is more than 3.5 centimeter and the width is greater than 1 centimeter. This is maybe the question SPA. The clitoris, like the penis, is very sensitive to the sexual stimulation and can be erect, resulting in gasp. So it is a rich supply of blood vessels and nerves. So if any injury to clitoris can result in profuse hemorrhage and can be extremely painful. It is the sensitive area. So what is the importance of the clitoris? It is important on the female genital mutilation. So what is meant by female genital mutilation? So this is the vial of any proceeds involving partial or a total removal of the external female genitalia or the other injuries to the female genital organ, whether for the cultural or the other non-therapeutic reason. So this is a common proceeds in the Somalia, Sudan, in the Egypt. So this is the cultural proceeds. So if any proceed involves the partial or the total remove of the external female genitalia, so this is called female genital mutilation. So what is the types of the female genital mutilation? So WHO classifies the female genital mutilation to four types. This is clinical is very important. And type 1, it is the partial or total removal of the clitoris or the pussy on if there is any clitoridectomy. So this is about the type 1. So if there's any partial or removal of the clitoris, this is the type 1. The type 2, if there's partial or total removal of the clitoris and involves the labia minora with or without excision of the labia majora. So type 1, it is involved the partial or total removal of the clitoris. Type 2 involves the clitoris and labia minora with or without excision of the labia majora. So what about the type 3? If any narrowing of the vaginal orifice with creation or covering seal by cutting and position of the labia minora and or labia majora with or without excision of the clitoris. So this is mean infibulation. So this is the type 3. So if there's any infibulation, this is the type 3. What about the type 4? So all other harmful proceeds to the female genital for non-medical purpose, for example, picking and piercing and seizing or scarping and precision. So this is about the type 4 of the female genital mutilation. So this is very important because many questions asking about the type of the female genital mutilation classification. What about the vestibule? Vestibule is the area between the labia minora. So the area between the labia majora, this is called or known as the vestibule. So what is the content of the vestibules? It is contains the opening of the urethra or the urethra and the vagina and the duct of the greater vestibular gland. So this is the content of the vestibule. And the vestibule is a part of the vulva lying between the two labia minora laterally and extended medially to the hymenal circle. So this is about the position of the vestibule. It is between the labia minora. So this is picture show this is the vestibule. Here, this is the vestibule. Here, this is vestibule. This is the area between two labia majora. This is the area of vestibule. So what about the Bartholin gland? Bartholin gland and located in the vestibule on either side. So they produce mucus and precipitate in lubrication during sexual intercourse. So it is very important in sexual intercourse because have reduced mucus and precipitate in lubrication during sexual intercourse. And in normal women, Bartholin glands are not palpable. So this is very important clinically because they are impalpable when healthy, but become obvious when inflamed or distended. So clinically, so any obstruction of this duct may lead to cyst or sometimes abscess. So this is many cases come with the Bartholin abscess. So this is may require drainage surgery. So if any symptomatic or there is recent recurrent cyst, so we need to drainage it is surgery. Skene's gland are pair of the paraurethral gland located on the anterior wall of the vagina around the lower of the urethra. So are the homologous with the prostate gland in the male. Besides this gland, there are minor vestibular gland located around the vestibule. So what was the hymen? Hymen have important anatomy, have the clinically important. Hymen is a thin membrane that surrounds the opening to the vagina. So it is close the opening to the vagina. So hymen can come in different shapes. And the most common hymen in young women is shaped like half moons. So this is the most common type of the hymen. And this shape allows menstrual blood to follow out of the vagina. So this is the importance of the hymen. If the hymen is opening or the like half of moon can allow for the menstrual blood to follow out of the vagina. So if this imperforate hymen, this is may make a problem, and patient may be present with the primary amenorrhea. So what is the type of the hymen? Is imperforate hymen. So imperforate hymen can sometimes be diagnosed at birth, and more often diagnosis is made during teen years. So imperforate hymen in a thin membrane that completely covers the opening to the vagina. So the menstrual blood cannot flow out of the vagina. So the menstrual blood distends the vagina. So this is called hematocolpus. So this mass is palpably abdominally, and by inspection you can see the vulva is spigal membrane with is bluish in colors, and the management by surgery. So it is cruciate incision to relieve the obstruction. So this is the importance of imperforate hymen. The other type is macroperforate hymen. It is a thin membrane and that almost completely covers the opening to the vagina. Menstrual blood is usually able to flow out of the vagina, but the opening is very small. So a young woman with a macroperforate hymen usually will not be able to insert a tampon into the vagina and may not realize that has a very teeny opening. So this is small opening, so difficult to insert tampon. If she is able to place a tampon in her vagina, she may not be able to remove it when it becomes filled with blood. So what is the treatment? It is a minor surgery to remove the extra hymen tissues, making a normal size opening for the menstrual blood to flow out and to allow for use with tampon. This is about the second type. What is the third type? Septate hymen. A septate hymen is when the thin hymen membrane has a band of the crystal tissues in the middle that cause two small vaginal opening instead of one. So in young women with septate hymen may have trouble getting a tampon or trouble getting tampon out. So what is the treatment? Also the minor surgery to move the extra band of tissues and create normal sized vaginal opening. So this is the hymen, the position of the hymen here. Here, this is the hymen, and this is the vaginal opening, and this is the clitoris, and this is the urethral opening. So this is the four types of the hymen. This is the normal hymen. You look for the openings. And this is imperforate hymen. It is closed. Again, opening not visible. So it is closed. Look here, it is visible. So this is the vaginal opening. So here the vaginal opening is not visible. So this is imperforate hymen. So difficult to pass the menstrual blood. So this is the macroperforate. So this is the small, very small opening. So this is the hymen, and this is very small. So difficult to insert tampon or to set out. Okay, and this is the septate. This is then opening visible hymen tissues. So this is about septate hymen. So we said there's imperforate hymen. So menstrual blood stains the vagina, hematocolpus, and the mass is sufficiently large. It may affect maturation and may palpable abdominally. So inspection of the vulva revealed a membrane that is blue in appearance with darkened blood transluminating through thin membrane. The management by surgically. The surgical treatment involves a cruciate incision to relieve the obstruction and form a range to the remaining quadrant of the hymen, may be left in situ or may be excised. Okay, this is about how to deal with the patient with perforated hymen. So what about the blood supply of the female external genital tract? So the blood supply from the following vessels: superficial external pudendal artery. This is the first artery. This is artery, one of the three superficial branches of the femoral artery near the inguinal ligament. It supplies the skin superficial fascia of the upper medial thigh and skin of the pubic region. So this is the artery, is superficial external pudendal artery. So it supplies the superficial fascia of the upper medial thigh and the skin of the pubic region. What about the deep? So the deep external pudendal artery usually derives from the femoral artery and supplies the labia majora. So the labia majora is supplied by the deep external pudendal artery. Through the deep external pudendal arteries usually arises the femoral artery. It may sometimes also arise from the medial circumflex femoral artery. So this is pudendal artery. The internal pudendal artery supplies the perineal and vulval structure, including erectile tissues of the vestibular pulp and clitoris. So it's vestibular pulp and the clitoris is supplied by internal pudendal artery. The last one is the inferior epigastric artery. The mons pubis is supplied by the inferior epigastric artery, which is a branch of the external iliac artery. So this is the question asked about the blood supply of the mons pubis. It is supplied by the inferior epigastric artery, which origin from the external iliac artery. So the blood supply here is very important for the vulva because there's many questions asking about the blood supply of the clitoris, blood supply of the mons pubis, and so on. What about the lymph drainage of the female external genitalia? The vulva drain into the superficial inguinal lymph node, and the lymphatic cross the midline in the anterior part of the vulva. So the vulva drain into superficial inguinal lymph node. So what about the nerve supply? It's very important to know the nerve supply of the vulva. The innervation of the external genitalia is mainly by the pudendal nerve, which arises from the anterior rami of S2 and S4. So here the pudendal nerve is very important because it supplies the mainly by supply of the vulva, mainly supplied by the pudendal nerve. This nerve branch anterior to form the Perineum nerve, and the dorsal nerve was the clitoris, which innervates the perineal membrane, external genitalia, and the clitoris. And this is the anterior. And posteriorly, there's another branch of the pudendal nerve, the inferior rectal nerve, supplies the ischiorectal fossa and the anal canal. So here's the pudendal nerve have the anterior branches to supply the perineal membrane, external genitalia, and the clitoris. And posteriorly have the branch which supplies the ischiorectal fossa. This is the urogenital triangle, and the anal anterior, the posterior triangle is the anal canal. So this is about innervation of the vulva. And the perineal nerve gives the sensory supply to the vulva. Also, it is innervates the anterior part of the external anal sphincter and levator ani and the superficial perineal muscle. So this is about the vision. This is very important. So the inguinal nerve as the genital branch of the genitofemoral arising from the lumbar plexus innervates the medial and lateral aspect of the vulvar skin respectively. So here the medial aspect is nerved by the ilioinguinal, and the genitofemoral nerve it supplies the lateral aspect of the vulva. So this is important. So what about the perineum? We said before the vulva it contains the female external genitalia and the perineum. So first discuss the female external genitalia, then we'll discuss the perineum. So what is the perineum? It's diamond-shaped region positioned inferiorly to the pelvic floor between the side. So we have picture to show the perineum area. Its peripheral boundary is the pelvic outlet. So it is silent is the pelvic diaphragm, the levator ani and coccygeus muscles, and its narrow lateral wall are formed by wall of the pelvic cavity below the attachment of the levator ani muscle. So perineum is divided in two: anterior, so urogenital triangle, and the posterior anal triangle. So this is very important. We have two areas of the perineum. Anterior, it is the anterior triangle. Is known as the urogenital triangle, and the posterior area, it is known the posterior or the anal triangle. So this is two important areas. So what is the content of urogenital triangle? What is the content of urogenital triangle? So the urogenital triangle is divided into a superficial and deep pouch. So it's divided by the perineal membrane. So this superficial perineal pouch and deep perineal space. So what is the content of the superficial perineal pouch? Anybody knows? What is the content of the superficial perineal pouch? Urogenital is divided by the perineal membrane into areas: superficial perineal pouch and deep perineal pouch. So you should know about the content of superficial perineal pouch and the deep perineal pouch. Anybody knows? So superficial perineal pouch is content of the muscles like ischiocavernosus and pulpocavernous and superficial transverse perineal muscle. So if you wanted to do episiotomy, you will cut this muscle. So this is the recall question, and also contains this Bartholin gland and clitoris, and maybe part of the pudendal vessels and nerve. So this is about the superficial perineal pouch, and the deep perineal pouch, it contains of the urethrovaginal sphincter muscle. So this is important, and the part of the urethra and the vagina. So this is about the content. You should know this. This is about border and sequence. This is here. Look for this. So this is the angle. This is the posterior triangle for the perineum, and this is the anterior angle. So this anterior angle is called urogenital triangle, and this is the anal triangle. So here the urogenital triangle is divided by perineal membrane in two. So in superficial and the deep perineal pouch. So here this is the acrotuberous ligament, and this is about the levator ani muscles, and this is the pubic surface and the ischopubic ramus. So this is about the border of the perineum. This is about perineal and deep perineal pouch. We said before it is contained of the deep perineal pouch and the superficial perineal pouch. Here, look for this is the vaginal origin. And here is the external anal sphincters. So this is the external anal sphincter. What is the importance of the external anal sphincters? Here it is about the perineal tear. So this is very important in case of perineal tear. Ischiorectal fossa. It is renamed as the ischioanal space since it is located between the ischial tuberosity and the anal canal. So this is the area of the ischiorectal fossa. The ischiorectal fossa is a fat-filled space on either side of the anal canal. So it is on both sides in the anal canal. It is fills the majority of the anal triangles, contain adipose tissues and inferior rectal nerve and vessels. So this is content of the ischiorectal fossa. This content of adipose tissues and the inferior rectal vessels. So this contains the inferior rectal nerve and inferior rectal vessels, and the right and left fossa allow the station of the anal canal during defecation. So this is about what about the boundaries? It is superior medially by inferior fascia of the levator muscles, and anterolaterally by the fascia covering the medial surface of the obturator internus muscle and the ischiotubers, and posterior laterally by the lower border of the gluteus maximus muscles and the sacrotuberous ligament. So this is about boundaries of the ischiorectal fossa. So this is the ischiorectal fossa. Here, this is the ischiorectal fossa. This is the perineal space, and this is the border of the here. This is the border. And you connect fascia, and here bordered by the fascia covering obturator internal. So this is the space of the ischiorectal fossa. So if there's any perineal tear, look here for this is the external sphincters. So what happened here if there's any external sphincter? Anybody knows the degree of the external, the degree of perineal tear? This is the important here of the external sphincter muscle because it is involved in the perineal tear or not. So there have 4 degrees of perineal tear. The first degree is just the skin laceration. If there's any skin laceration, so this is the first degree, and the second degree it involves the perineal muscle, but not involve the sphincters, external or the internal. So if they involve the internal or external, this is the third degree, and they subdivide 3A if involve less than 50% of the external sphincter muscle. If involve more than 50 of the external sphincter muscle, this is the 3B, and 3C if involve both external and internal anal sphincters. And the class 4 if this involving the sphincters and the anal mucosa. This is about the 4 degree of the perineal tear. What is the degree of the episiotomy? Anybody knows? What is the degree of episiotomy? Is it second degree or third degree? Episiotomy.
Second degree?
Yes, it is the second degree of
Second
perineal
degree.
fluid because it's what is the muscle
Perineal
is involved in this? What is the muscle is involved?
البيوبوكسجياس والسوارتيشيا ترانفيرس perineal muscle.
Yes, excellent, Dr. Adina. Yes, this is bulbous spongiasis muscles and superficial transverse perineal muscle. So this is the muscle involved in incision of the episiotomy, and this is the second degree. Okay, thank you. So what is the importance of the clinical, what is the clinical correlation of the ischiorectal fossa? It is this, the abscess. So is the ischiorectal abscess is the common clinical condition because the fat in the fossa is poorly vascularized. So the ischiorectal abscess is very painful because of the presence of the sensory nerve passing through the fossa. So this is the importance of the ischiorectal fossa. So now finishing about the vulva, which involves the external female genitalia and the perineum. Now we'll discuss the female genital tract or the pelvic organ. So we'll start with the. So what is the mean by female genital organ or the pelvic organ? So it is includes the ovaries and uterus and vagina and clitoris in the midline. So this picture shows the ovaries and broad ligament. So this is the ovaries, and this is the tubes and the uterus and the vagina. So first we'll discuss the vagina. What is the anatomy of the vagina? This is a narrow and muscular but elastic organs having a length about 4 to 5 inches in adult women. So this is the length of the vagina. It is connected the external genital organ to the uterus. So it is connected the external genital organ, which is involves the vulva, and to the uterus. So the vagina is the main female organ of sexual intercourse. It acts as pathway for the transportation of the sperm and from expulsion of the menstrual blood, and it helps in the delivery of the fetus. So this is the important function of the vagina. And the lower end of the vagina lies at the level of the hymen, and this level is surrounded by erectile tissues, which correspond to the corpus spongiosum of the male. The vaginal portion of the cervix project into the upper part of the vagina, result in the formation of the anterior, posterior, and lateral fornix. The posterior fornix, which is the deepest, is related to the rectotrial pouch. The posterior wall is about 4.5 inches long, whereas the anterior wall is about 3.5. So here the posterior wall is longer than anterior wall. Here the posterior wall is about 4.5 inches long, and the anterior is only 3.5 inches. So the posterior vaginal wall is longer than the anterior abdominal wall. The anterior and posterior vaginal wall are in contact with each other, not to the lateral wall. What about the vaginal mucosa? So the vaginal mucosa is lined by stratified squamous epithelium. There are no glands in the vagina, and the vaginal secretion are mainly derived from the mucus discharge of the cervix and transportation through the vaginal epithelium. The vagina has no gland, but the vestibular gland provide moisture for the vagina, and the pubicoccygeal muscles act as a sphincter for the vagina. The vagina is supplied by the uterine and vaginal branches of the internal iliac artery. So the blood supply of the vagina is by the anterior iliac artery. The uterovaginal nerve plexus lie in the base of the broad ligament on the other sides, or the supravaginal part of the cervix, give rise to the parasympathetic and sympathetic nerve supplying the vagina. What about the innervation of the vagina? So the nerve supply to the lower part of the vagina is from the branch of the pudendal nerve called the deep perineal nerve. This is about the lower part, and the upper part is by ureterovaginal plexus. So the innervation of the vagina can be in the upper vagina by the ureterovaginal plexus, and the lower part by the pudendal nerve. This is about uterus and nexia. Here is a vaginal orifice. What about the fallopian tubes? It is about 2 to 3 inches, 10 centimeters, equal 10 centimeters long, and extend from the upper edge of the uterus toward the ovaries. So this is about the length of the fallopian tubes. The two fallopian tubes normally extended laterally from the uterine corner and open into the peritoneal cavity near the ovaries by flaring into a funnel-shaped structure in fundibulum having a finger-like projection. So this is about the fallopian tubes. So what is the part of the fallopian tubes? So the fallopian tubes can be divided into 4 parts, which are the following. The first part is fundibulum. It is the funnel-shaped distal end on the tubes, which open into the peritoneal cavity through the abdominal ostium. The finger-like projection of the braided end of the fundibulum spread over the medial surface of the ovary. What about ampulla? It is the widest and the largest part of the fallopian tubes, which lie medial to the fundibulum, and fertilization of this site occur in this ampulla. So this is the site of the fertilization. Isthmus, this is the narrowest part. It is the thick wall part of the tubes which enter the uterine corner, and the uterine part, this includes the short intramural segment of the tube, which pass through the wall of the uterus and open via the uterine ostium into the uterine cavity at the uterine cornea. So this is also the shortest part, about 1 centimeter, and the isthmus is the north part and is about 2 centimeter, and the ampulla is the about 2 centimeter, and the ampulla is about 5 centimeter. So this is about the important part of the fallopian tubes. So what is the important of the tubes? Here there is tubal ligation. What is the benefit of the tubal ligation? It is the important procedure. So it is mainly in the used to prevent fertilization. So this is the important clinically. So what about the tubal patterns? If in case of the fertility, there may be need to assess this tubal pattern or not. So we have important investigation like what? Tubal pattern test. What is the type of tubal patent test? Anybody knows? Can you mention?
The
One of
HSG
the-
HSG, histosalpingography.
sound.
Yes, histosalpingogram.
Yeah.
And the second is
It can
laparoscopic andi
or laparoscopic test, dye test. Yeah.
Yes, this is the important tubal patent test. What about the ovaries? Ovaries are almond-shaped pair, colored female gonads responsible for producing oocytes and its female gametes on or the germ cell. It is commonly situated on the lateral wall of the pelvis in the angle between the external iliac vein and the ureters, where it can be palpated upon by manual examination. The normal ovary measurement is 4 centimeter, 2 centimeter, 1.inch to 1.75 inch. This is the normal measurement of the ovaries. 4 centimeter multiplied 2 centimeter. In the leprous woman, the ovaries are located inside the true pelvis on the lateral pelvic wall in the ovarian fossa. So this is the normal situation in nulliparous woman. But in multiparous woman, the location of the ovaries is not constant. So it may be changed. So yes, constant only in multiparous woman will be inside the true pelvis. Okay, this is about ovaries and ligament of the ovary related to the uterus and the other organ. The normal ovaries are not palpable normally in the abdominal examination, and these have ligament of ovaries. We have about 3 important ligaments. It is the mesoperium. So it is the mesoperium. It is the posterior extension of the broad ligament. So mesoperium, it is the extension of the posterior extension of the broad ligament, and the function of the mesoperium is to transmit the ovarian vessels and nerve to the ovary. So this is the main function of the mesoovarium. The suspensory or infundibulous pelvic ligament. So it is from the upper tube end to the pelvic wall. So it is to transmit the ovarian vessels and nerve to the broad ligament. So this is the important function of the suspensory ligament to transmit the ovarian vessel and nerve to the broad ligament. And the last one is the ovarian ligament. So this is from the lower end to the lateral angle of the uterus. This is about the 3 important ligament, ovarian ligament. What about the venous drainage? The venous drainage, the right ovarian vein drain into the inferior vena cava, and the left ovarian vein drain into left renal vein. So he is different in the venous drainage. So the right ovary, so directly in the inferior vena cava, and the left ovaries into the left renal vein. The lymphatic from the ovaries drain into para-aortic node, which is the recall curvature. The lymphatic from the ovaries is drained into para-aortic node. What is about nerve supply? The nerve supply to the ovaries includes the parasympathetic and postganglionic sympathetic and autonomic efferent fibers. So this is about the. So what is about the uterus? It is a thick-walled muscular pear-shaped organ located in the middle of the pelvis, in which the development of the fetus and embryo occur. The adult uterus consists of two main parts, the body and the cervix. The engraved uterus, malleolus woman, lies in the laser pelvis between the urinary bladder and the rectum. Uterus is formed by the 10th week of gestation by the union of the two Mullerian ducts, with the fusion beginning in the middle and then extended caudally and very direct. Okay, this is about origin of the uterus. The trine body is formed from the mesoderm, and the trine cavity is formed from the septum, dissolved slowly. So this is about part of the uterus. This is the fundus, the body, cervix, and this is the vagina. In adult woman, the uterine body is twice as long as the cervix, whereas the converse is true in newborn. So in newborn is here. In adult, the body is twice as long as the cervix. So in the newborn is the cervix twice as the uterine body. So the uterus consists of the fundus, body, and cervix. This is about important part of the cervix. So what about the attachment of the uterus or peritoneal attachment of the uterus? The important one is the broad ligament. So this is the double fold of peritoneum, which covers the uterus and continue up to the lateral pelvic wall. And the broad ligament, similar to the round ligament, has no supporting function to the uterus. Just help maintain the uterus in the position of anteversion. So we'll discuss about anteversion and inflection. The fallopian tube lies between the two layers of the broad ligament, and this part of the broad ligament is known as the mesosalpinx, where the part adjacent to the uterus is called mesometrium. So this is about broad ligament. So the most please mute your mic. What about the support of the uterus? This is very important because many questions came in exam asking about the support of the uterus, because if there's any problem, the support of the uterus can lead to gynecological problem like uterine prolapse. So what about the important? There are 4 factors that maintain the uterus in the anteverted and anteflexed position. This is the normally position. The uterus will be anteverted and anteflexed. So what is the important to support this position? First is the pelvic diaphragm. So this is the most important one. Support, since it is creates the uterus from below. So this is very important in support to the uterus. And the second one is the true ligament of the uterus, or the station of the pelvic fascia. And this ligament passes from the cervix in 3 different directions and fix it to the pelvic wall. So this is ligament form MRCOG of the distended condensed pelvic fascia and supports the uterus against vertical descent. Here, look here for the uterus, and this is the broad ligament. This is the broad ligament. So it here is important in case of the hysterectomy and uterine prolapse. About the normal position of the uterus, so we said anteverted and anteflexed. So when the urinary bladder is empty, the position of the uterus is described as anteverted and anteflexed. So the body of the uterus is tilted forward on the superior surface of the urinary bladder, which provide support to the uterus. So what is the definition of antiversion? So what is mean by antiversion? So the term antiversion is divided as an angulation between the long axis of the cervix and long axis of the vagina. This is the simple definition of the antiversion. So antiversion, it is defined as angulation between the long axis of the cervix and the long axis of the vagina. So if you want to know about the antiversion, look for the cervix and the vagina. So if there's angulation, this is called antiversion. So what about mean by antiflexion? Antiflexion is this angulation between the long axis of the body of the uterus and long axis of the vagina, of the cervix. So here is the difference. The antiversion, the angulation between the long axis of the cervix and the vagina is related to the long axis of the cervix and the vagina. This is antiverted, and the antiflex is the long axis of the uterus related to the cervix. So this is the difference between antiflexion and antiversion. So this picture shows the difference between the angle of antiversion and angle of antiflexion. So antiflexion, here the long axis between the uterus and the vagina, and the antiversion here the long axis of the cervix and the uterus. So this is the difference between angle of antiflexion and antiversion. Is it clear? So this is the abnormal position of the uterus. Here is retroversion, and here is retroversion and retroflexion. What about the blood supply of the uterus? The main blood supply to the uterus via the uterine artery, which is the branch of the anterior trunk of the internal iliac artery. So internal artery gives the uterine artery which supplies the uterus. So this is the important blood supply for the uterus. So it is from the uterine artery, which is from branch of the internal iliac artery. This is about the course of the uterine artery. So this is all about the external, the vulva, which involves the external perimeter tract and the perineum, and discuss about the pelvic organ. So this is about. So we'll start the question. Who will share this question?
I will read.
Yes, sure.
Which one of the following structure is the termination of the round ligament? A. Deep inguinal ring. B. Labia majora. C. Labia minora. D. Lateral vaginal wall. E. Superficial inguinal ring.
Yes.
The answer may be
Termination
labia
of
majora.
Yes,
Round
excellent.
ligament.
Yes, the round ligament is related to the labia majora. Yes, you are right here. So it is B. Agree with B?
Yes.
So the correct answer is the labia majora. The next question. Who? Dr. again.
Which of the following regarding the vagina is correct? A. The paramesonephric duct gives rise to both uterus and entire vagina. Is 7 to 10 centimeters long. The urogenital sinus. C. The urogenital sinus gives rise to part of the vagina and the proximal part of the urethra. D. Becomes canalized at 22 weeks of gestational age. E. Vaginal fluid has a lower potassium concentration than plasma.
Okay. So, which is true?
B. Is it C?
C.
Who said B?
No, C.
So B.
C.
B or C?
For me, C.
C.
A. A.
So it is
C.
B. Yeah, the answer is B.
B. Okay.
The length is about 7 to 10 centimeters.
Centimeters.
Will share?
Yes.
D.
Okay.
Okay, Dr. Maya.
Parayortic. What is the lymphatic drainage of the ovaries? And the answer should be parayortic.
Answer, Dr. Maya. So what about the ovaries?
Answer is D. Para-aortic nodes.
Yes, para-aortic nodes. Yes, drain of the ovaries is the para-aortic node. Yes, the para-aortic node. Question 4 will answer.
From which of the following is the nerve supply to the vulva derived? A.
Okay, Dr. Arafa.
A. Genitofemoral nerve. B. Ilioinguinal nerve. C. Pudendal nerve. D. All the above. E. None of the above.
The answer is D.
The answer is
D.
D.
All of the above.
D
All
of
the
the
above.
yeah D.
Yes, you're right. All the above.
All of the above.
Yes, D. Yes. Question 5.
It's E. Vaginal branches of uterine artery, which vessels anastomosis with the vaginal arteries from the blood supply to the lower third of the vagina. No, it's C. Terminal branches of internal pudendal artery.
Okay. Thank you, Dr. Abina. Who will answer this question?
This blood supply of the vulva is derived from which of the following? Deep external pudendal, internal pudendal, superficial external pudendal artery. D. All of the above. Answer is D.
Yes.
Yes, answer is D.
Thank you, Dr. Abina. Thank you, Dr. Adina. Thank you. Yes, the answer is D. Next question. Anybody will share?
Sir, the changes which occurs in the vagina at puberty includes which of the following? An increase in the pH, reduction in the number of Bartholin bacilli, exfoliation of superficial cells. It's answer A, increase in the pH.
The answer is A. What about C? Okay. What about agree with A?
I think E.
What about the C? Yes, the answer is C. Agree? So the last question.
Inshallah. Which one of the following dermatoma levels correspond to the innervation of the anus? S4.
S5.
S4. Yes. S4 or S5. Which is the answer is correct?
Sir, S5, S3, 4, 5. S3, 4 is for anal reflex and S5 is for innervation of the anus.
So S5 is the correct answer. Agree? Yes, the correct answer is A. Okay, thank you. Thank you all, inshallah. See you in the next Saturday, inshallah.
Thank you.
Thank you all.
Thank you, sir.
Thank you, Dr. Fan.
You are
Thank you,
welcome.
Dr. Fatah.
Thank you so
Thank you.
much.
You are welcome.
Doctor.